Hey everyone, welcome back to my channel Dental Cafe. In this video, I'm going to show you how to take a maxillary primary impression in completely edentulous jaw. It's a clinical video, so watch till the end. Okay, then let's begin the video. So these are the trays we are used for primary impression. So we have two types of trays. This is we have a perforated one, and this is we have a non-perforated tray for edentulous impression. And this is for mandible, and this is for maxilla. And same in perforated, we have two types. This is for mandible and this is for maxilla. So we are using stock trays. If you are using alginate as impression material, then you have to choose perforated tray. And if you are using impression compound, then we'll use these stock trays. But we can use edentulous stock trays in with alginate impression material by just drilling the tray, because these are the aluminum trays. We can easily do a correction in these trays. As you can see, we have already made a hole in this tray because we are using these trays for alginates. Selection of appropriate size of tray is very important. So how to select a tray? Important point: border of the tray should be 5 to 6 mm larger than the outer surface of the ridge, so that we have enough space for the impression material. Suppose this is we have a patient cast. If we are going to place a tray over this cast, then it should be 5 to 6 mm larger than the outer surface of the ridge, so that it can support the material. And the second thing, these are the aluminum trays, so we can do a minor adjustment to fit the patient mouth. So we'll adjust if it is needed. As you can see in this video, second tray is already bent in the shape of the ridge of the patient mouth, so that impression is more accurate. And it should cover the PPS and the hamelar notch. If tray cover the PPS and the hamelar notch, then it is easy for us to record the PPS in the final impression. As you can see in the video, if you are going to place a tray, it should cover the hamelar notch, which is the posterior most extension, and the PPS. If you want to know more about the landmarks, that where is hamelar notch located, where is PPS located, I have already posted a video. You can watch there. Second step is material selection. It is very important. So in this patient, I'm going to use a alginate. We can also use impression compound. So with alginate, we are using a flexible spatula, so that mix of the alginate is very good with the flexible spatula. Instead of alginate, we can also use impression compound, but it all depends on the patient ridge. Material selection varies from patient to patient mouth. In case of severely resorbed ridge, we cannot use alginate because alginate is not self-supporting material. Now we are going to mix the alginate. We are going to pour a water slowly and then mix the alginate in the figure of 8, so that there is no entrapment of air or bubble in the material. Also along the wall, so that if there is any air entrapment in the alginate, it will be popped out. As you can see in the video, we have a creamy mixture of alginate. Now we'll load the material on the tray, and then we will press the material so that it will take a shape, and avoid excess material in the PPS area, otherwise it will cause gag reflex to the patient. This is how we will load the tray with material. Don't overload the tray, it will definitely cause the gag to the patient. Our material is ready for the impression. Now we're going to put it in the patient mouth. Now retract the patient lip and the cheek and put the tray in the patient mouth. And for maxillary impression, always remember, stand behind the patient, not the front of the patient. For mandible, we are going to stand in front of the patient. Mark the label frenum as a guide, and tray handle and frenum should coincide. And once tray is seated properly, Then only do a border movement by holding the tray from the center. The lips are elevated and then extended outward, downward, and inward to record labial frenum and labial vestibule. The cheek is elevated and pulled outward, downward, and then inward, and then move backward and forward to record buccal frenum and buccal vestibule. And we'll do a lip and a cheek massage so that material can go into the depth of the sulcus. And this is, we have a primary impression of edentulous jaw with alginate. All the landmarks are properly recorded. As you can see, we have a PPS, frenum, vestibule, all are properly recorded. And this is, we have a impression compound impression. So this is, we have a labial frenum, buccal frenum, tuberosity. In red we have a hamular notches, and then we have a PPS. Avoid common faults in impression making. So first one, poor selection of tray. If your tray selection is poor, then it will not completely support the material and all the landmarks are not completely recorded. Insufficient material loaded in the tray. If material in the tray is insufficient, then it will not flow to the sulcus depth. Excessive material loaded in the tray, then it will definitely cause the discomfort to the patient may feel gag reflex. Incorrect position of the tray. If your tray position is incorrect, it may hurt the patient mucosa, and patient will not able to give all the border movement. I hope this video is helpful for you to understand how to take primary impression of maxillary arch. In next part, I'm going to tell you how to take mandibular impression in completely edentulous jaw. So don't forget to like, share and subscribe my YouTube channel and hit the bell icon for the latest video.